Hi, my name is Ellil Mathiyan and I'm a patient ambassador and patient advocate. Before I was diagnosed with cancer and had my stoma, I used to do boxing, fencing and even squash. But of course, after you have the stoma, you need to modify your sports a bit, and now I do more of dragon boating, kayaking, brisk walking as well as Zumba. But today, I'll be sharing on swimming with an ostomy. Whether you're a veteran or new to ostomy, you may be nervous about swimming as the thought of having a leak in the pool can be quite scary. So when you first go swimming with your ostomy, definitely going to be this feeling of anxiety. Because you're wearing a bag now, is the bag going to come off? Is there going to be a leakage? So after a few times, you get used to it. And then before you start swimming also, you should be seeking the advice of your doctor first to see if you can resume such activity. Then your stoma nurse. The stoma nurse is full of information for you because they know patients who have done this before you. And lastly, speak to your physiotherapist so that they can tell you if the activity you're going to do is, too strenuous for you or if it's going to cause a hernia or something. Swimming is typically okay as soon as the surgical incisions are healed. With your weight supported by the water, swimming gives your muscles a workout with minimal risk of injury. Swimming helps you develop more flexibility, and it's a good option if you have arthritis. So with the right supplies, water aerobics and swimming with an ostomy are great ways to exercise, strengthen some muscles, and are pretty fun. So when you're going swimming, you can either use the usual bags, either the 1-piece or the 2-piece, or you can go for something smaller, which is the Centura mini cap. So when you're going swimming, waterproofing your ostomy is important. To do this, you can use elastic strips and seals to waterproof the base plate, or protective sheets cut to fit around the base plate. So you may wonder how salt water and chlorine affect your ostomy. Salt water and seawater basically affect the wear time in that they reduce it by 1 day. Chlorine doesn't really affect wear time. Even if it does, at most it will reduce it by a day as well. So make sure to pack an emergency kit in case of a leak. Some of us can be quite conscious when going swimming with an ostomy, and we all have different comfort levels. So to make it easier, we can use a pouch cover if the pouch is transparent. For women, you can use swim wraps or swimsuits, for example, a 1-piece, a tankini or a high-waisted bottom. For men, you can use swim wraps as well, swim trunks, t-shirts. And what about beach and water sports, right? For example, surfing. You can also use swim wraps, swim trunks, and even wetsuits. Typically, most swim styles are okay for ostomates, like freestyle, breaststroke, and backstroke. But butterfly stroke is not encouraged because it's a bit more strenuous. And if you want to do it, you need to check with your physiotherapist first. So what do you do after getting out of the water? You go to the changing room and you check your ostomy. Make sure it still fits well, make sure there are no leakages. If there is, then you change it to a fresh one, and then you're good to go. So as you can see, with the right supplies and clothing options, swimming with an ostomy can be a great way to relax, get a good workout, or play with your family.